It is a season for overindulging. Holiday cakes, cookies, and candy tempt our collective sweet tooth, or sweet teeth, I should say. That's why we see more ads this time of year about weight control and weight loss.
Yeah, well, we're just talking about wine and bratwurst.
Yeah, right.
Like,
Which sounded good.
I don't think that's a diet thing.
No.
Yeah.
No.
But you don't hear often about the opposite, taking weight loss too far. And there are dangers with being too thin, no matter your age.
So joining us today to explain the warning signs and risks of being underweight is Dr. Fri Awasum, Regional Chief Clinical Officer for Jencare Senior Medical Center right here in Chicago. So Dr. Awasum, thank you so much for joining us.
Absolutely, happy to be here.
Thank you. Okay, so let's talk about being underweight or too thin can be a sign of an underlying health condition that needs to be treated, or a sign of a behavioral health situation as well, right?
Absolutely, you said that perfectly. So, you know, things like diabetes, being under control, your thyroid being out of control, that can cause significant weight loss and put you at risk for even more health concerns too.
Interesting.
So what are some of the causes for that, you know, being too thin? What do you, as a doctor, I mean, you went over them a little bit, but what do you guys look for? When someone comes into your office and says, Doc, I don't know what's going on, you can probably pinpoint pretty immediately sometimes the visual signs, and probably one is being too thin, right?
Absolutely, absolutely. So what you said is perfect. Doing a physical exam, taking a look at the person can give you a lot of information. The first thing we think about is nutrition. Is this person eating enough? If they are eating enough, are they eating the right things? Access to healthy food is not a given. And where we live in Chicago, there are things like food deserts, and we have things like food insecurity to be concerned about. Another thing to think about is medications. Are you on the right medications? Some medications have side effects. Some side effects of medications is that they reduce your appetite to the point where you don't want to eat and you can lose weight too quickly. Another thing to think about is behavioral health. Things like depression can ruin your appetite, make you not want to eat, make you not want to take care of yourself. And there are even some mental health conditions like anorexia that can cause you to be too thin and not eat enough to where you put your body at risk for a number of health concerns.
And so important to destigmatize these things. Like anorexia is a mental health condition and something to be aware of. It's fascinating. We talk so much, before Jackie gets to her next question, we talk so much about overweight and, you know, the obesity epidemic in America. What percentage of people are clinically, like by definition, you know, so empirical data, would you know would be you know, demonstrably underweight?
It's not a common problem, but I will say that it's more common in older adults. We've all kind of seen like the tiny little old ladies who are super, super frail.
Right.
A lot of our elderly adults are also very isolated. Sometimes due to other things that are going on with their health, they can't cook for themselves. They don't have anybody checking in with them. So the population that I see frequently is older adults at Jencare. And I actually see it every day, multiple times a day.
Yeah, and that leads to osteoporosis.
Absolutely, absolutely.
And that's why, you know, unfortunately, so many of the seniors we love are one fall away from it.
Oh,
being,
yes, yes. Definitely osteoporosis or weak bones can be a side effect of being too thin. And things like they're at risk for things like falls, for sure. But other things like anemia and, you know, being immunocompromised or being susceptible to illnesses very quickly, which is a big deal in flu season where we are right now. So there are a lot of things that I look at and discuss with my patients as I'm seeing them, because I definitely want them to be at the healthy weight is what I emphasize.
Is it simply just eating more, or do people have to also be on medication in some cases?
So it depends on the cause. Like I said, things like out of control diabetes can be a driver for being underweight. So getting the underlying disease under good control is important. There are medications that I can use to increase appetite, but I have to make sure there's nothing else going on that I'm missing. I want to make sure that I treat the underlying cause before I just give you a medication to gain weight.
Of course, I've never seen you as a patient, but I can tell that you're an incredible doctor just by sitting across from you.
Thank you.
How do you spend so much time with your patients and make the appropriate amount of time to really discuss everything that's going on in the patiant's life?
Yeah, because I was going to say, too, it's like, and I don't want to interrupt you, it's got to be more than take this, eat more. I mean, there's got to be a lot beyond that. I mean, a lot of follow-up, I mean, especially if you're dealing with, you know, I would imagine, like with older people, when they can't go for, there's depression there. There's a whole universe of things happening that create this too skinny?
Yeah, I work at a really cool place, Jencare. We have an awesome care model what allows us to see our patients once a month. So I'm able to spend a lot of time with my patients. Because like you said, you can prescribe something, but a person has to be motivated to take that medication. A person has to be motivated to take care of themselves. So I do a lot of motivational interviewing, encouraging people, getting to the root cause of why they don't want to take care of themselves, getting them really bought into the process that they're important. I want them to be here. You have a person, you have a coach, you have a friend in this process. And so I'm able, and also just able to encourage them to do so. And we're actually able to see a ton of progress.
Okay.
So being able to see a patient once a month, one, I'm able to catch on if a person's losing weight, either not on purpose or they're doing it at too fast of a rate. And then I can see if the things that we're doing, if they're making progress. I can track their weight and make changes as needed to the care plan.
Okay.
That's incredible.
Dr. Fri Awasum, not only are you obviously delightfully
Yes,
smart, but
absolutely
you have
delightful.
a wonderful bedside manner. So we're sure.
Couchside manner.
Yeah, outside manner even. So it's a pleasure to have you on.